So first I'm going to discuss the assessment of blood glucose. To do this, I would use an AccuCheck. So in this case, it's before the patient eats their supper. I would choose one of the 3 middle fingers and I'd use a swab. And I would swab the end of the patient's finger. And then I would milk the finger and hold so that all the blood goes to the end of the finger. And then the first drop of blood I would wipe away since it's mixed with the alcohol swab. And then I would use the second drop of blood to place it at the end of the machine. And once that's complete, I would place a cotton swab on the end of the patient's finger. So if the patient has hypoglycemia, their blood glucose is less than 4 millimoles per liter. So the nurse can see this in their patient. If they have a headache, blurry vision, they're sweaty, they're irritable, restless, tachycardic, hungry, or dizzy. And then the patient has hyperglycemia if their blood glucose level is more than 7 millimoles per liter. And then the nurse similarly can detect this through if their patient is confused, lethargic, they have polyuria, they are thirsty, excessively thirsty, or they have volume depletion. And then another important thing for a diabetic patient is their food intake. It's important to note, and they need to be aware of high GI or high glycemic index foods. So this could be donuts, cake, candy, ice cream, any foods with high sugar contents. And it's a good nursing practice to health teach them to be able to identify these foods and understand that they may need to do certain things when they have these foods, such as exercising after they have it. So to begin, I'm going to check the MAR, any allergies. I'm going to check both the scheduled and the correction scale, as well as the diabetic record with the medication, and this would be my first check. And then at this point, if I needed to, I would check the drug reference information, such as safe doses, nursing implications that I need to be aware of before starting. Next, I'm going to calculate the correct amount, and in this case, I've calculated it to be 4 units since she's having it before supper, and then once again, I've checked that with the correction scale, and then 4 units after I've checked with the diabetic record as well. Perform my hand hygiene. I'm going to swab the top of the vial in a circular motion and allow that to completely dry. Then I'm going to use the insulin syringe, which I've checked for expiration, tears, holes, shreds, and I'm going to draw the correct amount up in air. Since I don't have an insulin cartridge, then I wouldn't need to. And then I'm going to inject the air, flip it upside down, and then pull back the 4 units. Then I'm going to flick for any bubbles and check all the way around. Then using safe one-handed technique, I'm going to pull back. At this time, I would perform my second check with the medication, and then I would need to request an independent double check since insulin is a high alert medication. So once I've grabbed my independent double checked, I'd go into the patient's room, perform my hand hygiene, provide my safety, pulling the curtain. I'd introduce myself as a second-year nursing student, and then I'd identify the patient with their full name and date of birth, using 2 identifiers, and then I'd check that with their wristband and make sure that it matches, and then also the wristband with the MAR and what the patient says. At this time, before proceeding, I would verify any allergies and explain to the patient, and then identify like their knowledge of the procedure. And then for the site of choice, I'm going to use the abdomen, and I'm going to use this because it tends to be the best site because there's a lot of adipose tissues to inject into, which helps with absorption. But I can also inject into the anterior thigh or the posterior upper arm if needed. And then before proceeding, I would inspect the site. And to do this, I would look for any bruising, inflammation, edema, or any signs and symptoms of infection. And if I saw this in the site, I would not inject into that site and choose either like another site that didn't have any of those signs. And then I would palpate for a mass or tenderness, and I'd look for lipohypertrophy, which is like a lump underneath the skin, which is like excessive fat under the area through like injecting the subcutaneous insulin too often. And to avoid all of these, it's important to like rotate the site of the injection. So to do this, you can rotate between the 3 different injection sites, or if they're unavailable, you can like divide the abdomen, for example, into 4 quadrants and inject into a different quadrant each time and rotate clockwise. And then you can document the site that you injected into so that it's not used too often, and say that you used the right upper quadrant. So next I would take a swab at my site, and in this case I'm going to go 2 inches from the umbilicus and the abdomen area, and I'm going to swab and I would have put my gloves on before injecting. Allow that area to dry. And then I want to plump the skin, and for subcutaneous, you can use a 45-degree angle or a 90-degree angle. In this case, I'm going to go in at 45, administer slowly over 10 seconds, hold for 10 seconds, and then withdraw the needle, put the safety cap on right away, unpinch the skin, and swab. And then dispose of in the sharps container. And then after that, I would reposition the patient until they're comfortable. I would document the site and the time that I gave the injection on the MAR, the diabetic flow sheet, or the anticoagulant record. And then since Humalog, the insulin given, is a rapid acting insulin, I would come back in 10 to 15 minutes to evaluate the effectiveness.